like to talk to you about some fundamental core exercises. In anatomy, our body has muscle in the front, on the side, and the back. For the deep stabilizer exercises in our core, we categorize it into one major one called the pelvic floor. It goes from the pubes, go down and attach to the tailbone. Much imagine like a hammock. I want you to activate them by lifting it up. Hold it for a 5-second hold, repeat about 10 times. Usually we call these the Kegel exercise. The second part, imagine when we talk about the muscle that goes across like this, we call transverse abdominis because it goes across. Imagine if you have a wire that's attached to your belly button and it's pulling straight back towards your spine, then you activate it. So if you could activate these two by doing the Kegel first up and pull your stomach in second and just hold it there. While you're holding there, you should be able to breathe in and breathe out without losing them, okay? So that just make sure you don't use the air to suck the muscle in. I would like to demonstrate we call the McGill Big 3 exercises. It's created by Dr. Stuart McGill from University of Waterloo. These are very good fundamental exercises. The first exercise he calls the curl up. If you lie flat on your back, keep your spine neutral, put your hand underneath the arch here, called the lordosis, to keep it straight, and bend one leg up here. And he wants you to lift up your head very gently, but don't push your back down to the bed. Just keep it neutral. And I'll demonstrate here, just curl up. You don't have to go too high. You'll feel your abdominal muscle, which are here, are activating, and come on back down, like that. That's the first one. He calls it the curl up. The next one we will do is called the side plank. We're going to start with more basic level. So if you lie on your side, keep your knee bent, try to line up your thigh to your body in a straight line, and you can lift it up. If you have a mirror, you can see yourself, make sure your spine is straight. Don't go too high, then you got a curve like that. That is not good. You want to feel the muscle down here working. I'm going to hold for 20 to 30 seconds. And then you can drop down. I would do about 2 to 3 repetitions of it. If you're better than that, you could do it with straight legs. If you keep your legs straight, again, make sure your leg and your body is in a straight line, and you lift it off, going that way. If you find that difficult initially, you might use your other hand just to hold it a bit, and as you get better, you can lift it off. The next one we will do is called the bird dog. You're going on your hands and knees, and then you're gonna raise your opposite arm and opposite leg. So we get to this position, make sure your spine is straight, don't arch up your back, and don't dip it down like that, okay? You're gonna keep it neutral. And again, you can engage the Kegel, the pelvic floor, and the TA first, that'll be great. You're gonna raise the opposite arm and leg, try to keep your body straight, hold for 5 seconds, bring it back down. I usually do it one sling first, okay? I would do 5-second hold for 10 repetitions before you switch to this side. So one of the most common problems that I see is people either go too high, then you start to arch your back and hyperextending it, or they're going too low and not reaching it. And I want you to watch out that your spine, when you do this, do not rotate, okay? So I'll show you, if you rotate, start to go like that. The key is to keep it neutral and extend it out for that. Bring it back down. I would do 2 sets of 10 repetitions. So do 10 on the right, go to 10 on the left, come back to do 10 on the right, and go back to do 10 on the left. So besides the big 3, I would like to add in the front plank as well. It is very useful. We're gonna start on a more basic level where you're gonna do on your knees. If you move your knee out a bit, go on your elbow and just sustain. Make sure your body does not dip down. Make sure you don't arch up too much, okay? Go for 20 to 30 second hold for 3 to 4 repetitions. When you're better, you're gonna go and do the full plank. You're gonna go on your toes, lift it off again. Don't go too high, okay? Just about there. Hold for 20 to 30 seconds. We talk about the deep stabilizer exercises early on with the pelvic floor and the TA. So in daily life, you could activate these. You could do them in sitting while you're working in front of the computer. You could do it while you're driving. If you come to a stoplight, basically you could activate the pelvic floor and then pull them in and just maintain there. So it's not a big motion, but if you do it for a longer time, you'll feel those muscles working. Also, when you're bending and lifting, let's say picking up a baby from a crib or lifting a case of water, I would like you to activate those muscles. Therefore, you'll protect your spine. In summary, we have these basic fundamental core exercises. If you could do them every day, that would be great. It should not take you more than 10 minutes to do all these exercises, but you will keep your core strong, prevent injury, and keep your postures better.